Krishna Manohar, and I'm a second-year medical student and this semester's team leader for the I-CCEW OKC team. I'm so excited to have you all here to witness the first ever I-CCEW OKC team give their presentation and showcase some of their hard work. These incredible individuals have risen to the standard that is I-CCEW and also been working on their individual difficult degree programs. So 4 months ago, we were tasked with working with the Stevenson Cancer Center and looking into solving the problem of helping to increase rural access to Oklahomans that couldn't get cancer care and treatment. And to do so, we began looking at the treatment process that cancer patients face, from screening and diagnosis to treatment and follow-up. The problems we found were many, including transportation issues and the lack of professional expertise in rural areas. And so through over 50 patient and expert interviews and benchmarking against some cancer institutions throughout the country, we came up with strategies to address these issues, many of which you'll hear about today. And this would not have been possible without the help of some key individuals that I'd like to thank: our mentor, Dr. Schumann, our clients from the Stevenson Cancer Center, who have helped us throughout this process with feedback and support: Dr. Mantle, Ben Eichert, Claire Termel, and 2 of them are here today, so thank you for coming. And then also, of course, the I-CCEW staff, who have been pushing us and supporting us to always achieve excellence. And so before we begin, I want to highlight the special traits that come with coming and working in a team like this. So we're an interdisciplinary team from degree programs across the health sciences campus. And it's the diversity of such a team like this that really helps us clarify some of our strategies and solutions. To solve big problems in Oklahoma, it's not one discipline that will have the answer. We'll have to work across different disciplines to come up with solutions to the big challenges that our states face. And so, without further ado, I'd like to introduce these incredible individuals to tell you more about how we can solve access for rural Oklahomans to cancer care and treatment. Ben Franca, Jimmy Manyanga, and Betsy Waller.
Our state ranks poorly relative to other states in the nation in terms of cancer incidence and mortality rates. Indeed, the situation is worse in rural Oklahoma. This semester, the Stevenson Cancer Center, the only comprehensive academic cancer center in our state, has challenged my colleagues and I to come up with strategies to improve cancer access for rural Oklahomans. After 4 months of active research and talking to more than 50 patients and other experts, we are excited to share with you 4 innovative strategies that will improve cancer care access for rural Oklahomans. These are angel flight and ride-sharing platforms to tackle the transportation problems that patients face. And the third one is teletumor boards, so that patients who do not have access to specialist oncologists would have it. And lastly, to build a pilot infusion center in Northeast Oklahoma, so that patients in that part of Oklahoma can have access to chemotherapy services close to home. Our research has revealed that these solutions have the potential to bring in more than 2,000 new patients to SCC and raise in excess of $80 million in the next 5 years. Good afternoon, everybody. My name is Benjamin Frimpa. I'm a PhD candidate in the pharmaceutical sciences in the Graduate College, and I'm from Accra, Ghana.
Good afternoon, everyone. My name is Betsy Waller. I'm a first-year public health candidate from Marlow, Oklahoma.
Good afternoon, everyone. My name is Jimmy Manyanga. I'm a PhD student doing cancer research, and I'm from Zimbabwe.
We would also want to recognize our clients, Ben and Claire. Now, as I said early on, Stevenson Cancer Center provides the best option for cancer patients in our state. It ranks #1 for patient care. It is the only cancer center in our state that provides phase 1 clinical trials and is currently under review for the National Cancer Institute designation. This means that very soon SCC will be part of the allied group of cancer centers in the country that is both recognized and supported by the National Cancer Institute. So indeed, there is good quality care for cancer patients in our state. The problem, however, is that when you go to many of the rural counties we have in our state, they have limited or no access to cancer care. And most of these counties also have very high mortality rates. So if you look at the graph on your left, you see that when you compare rural Oklahoma to even urban Oklahoma and the US, more people die from cancer-related deaths, high mortality. When you look at the graph on your right, you see that most of these counties do not have comprehensive cancer care centers available, which is no access to cancer care. So the challenge is, how do we solve this? My team and I have spoken to more than 50 patients in our work, and most of the patients we talk to complain of one or more of these three main problems. The first one is transportation. 10 to 30% of the patients we talk to said that they miss their appointments due to lack of transportation. And also in our state, more than 27% of the adult population do not have access to driver's licenses. Number two, when you look at rural Oklahoma, you realize that they have about 80% less specialist oncologists per capita when you compare it to urban Oklahoma. And the last one is when the patients we talk to, they talk to us about the pains they have to face to commute long distances to receive cancer care at the SCC. So looking at these issues, how do we solve them? My team and I suggest a four-pronged strategy for SCC that would improve cancer care access for more than 70% of patients in rural Oklahoma. Now, these are to tackle the transportation issues, angel flight, and ride-sharing platforms, and then to tackle the lack of access to specialist oncologists. We recommend physician access through tele-tumor board, so that patients in rural Oklahoma can remotely have access to the top quality oncologists we have at SCC. And lastly, we want to pilot an infusion center close to the Northwest Oklahoma region so that patients there can receive chemotherapy services close to them. These strategies have the potential to bring in more than 2,000 new patients to SCC. I'll at this point hand you over to Betsy, who will talk to you specifically about our transportation solutions.
Good afternoon. As Ben mentioned, I will be covering the topic of transportation, and we want to start by diving in to discussing Angel Flight. So Angel Flight can provide free flights for patients who live more than 300 miles away. At this point, you're probably wondering, what is Angel Flight? Angel Flight is a nonprofit organization that builds a database of pilots who volunteer their services, time, and planes to take patients to their treatment. So you start out with this patient who lives in rural Oklahoma and they need help getting to their appointment at Stevenson. So they would get in contact with Angel Flight and schedule their appointment. And from there, Angel Flight would coordinate with the pilot to get this patient to Stevenson, and then they would receive their regular treatment at Stevenson. And we know that this works because we've benchmarked this and interviewed several patients who have actually used Angel Flight. And there's one particular patient from Norman, Oklahoma, and he has flown from Norman to Houston up to 2 times a month to receive his treatment, and he said that it is an excellent service and he would recommend it for any of Stevenson's patients as well. And some of the key information about Angel Flight, which makes it lucrative for Stevenson to utilize, it can be implemented at no cost to the patient or to Stevenson Cancer Center, just simply to get them in contact. And we've spoken to the director, and they're already looking forward to working with Stevenson on this effort. So from our calculations, we know that 800 current patients can benefit from this, and they can accumulate 800 new patients for a total of 1,600 patients who can benefit from using Angel Flight. Now, on that topic, you might have to get the person from the airport to Stevenson. So to do that, we've looked at ride-sharing solutions. And some of the main ones we're suggesting that they use are SendARide, which is a former I-CCEW client, and Circulation. They're already utilizing SoonerRide pretty regularly, but these are some new suggestions that we want to put on the table for Stevenson. So basically the way ride-sharing works, you have this patient who, again, does not have the transportation they need to get their treatment. So they would schedule a ride via SendARide or Circulation, and this can be done by calling Stevenson or on the app that the platforms already offer. And then from there, they can get their ride and then go get their regular treatment. And then they can take their ride back home. So we know that this works because SendARide and Circulation have improved patient no-shows from 25% to 8% at some of their already existing clients. And then they will reduce clinical dropout rates from 30%, which is an excellent thing considering that Stevenson is an academic cancer center. And another thing, this will increase the transparency and reduce taxi voucher fraud. In studies with other clients, they showed a reduction from $40 to $20 per ride. So that could be an excellent area where Stevenson can improve their transparency. And then another benefit to the patient, if they aren't able to pay for the ride on the spot, or they're having issues, they can have this ride directly billed to their Stevenson bill, and it can all be lumped into one place, so they're not having to do so much runaround with the paperwork and such. And our calculations show that 2,900 current Stevenson patients who are rural can benefit from this, and up to 800 or over 800 new patients can benefit from this, for a total of 3,700 rural patients. And this is just rural, so there's obviously more potential for people who are nearby and considered more urban. But from there, I'll hand this over to Jimmy to talk about teletumor boards for those who ride sharing and Angel Flight might not be an option.
So tumor boards are a group of physicians who meet together regularly per week to discuss different cancer cases to find the best outcome. And out there, there's many studies that have shown the benefit of using tumor boards in improving cancer care. So, but what do you do when you stay in rural Oklahoma? You do it like this is only possible in a big institution like the Stevenson Cancer Center. So what do? This is where teletumor boards come in place. So with teletumor boards, you have the patient in rural Oklahoma. The patient goes to see the primary oncologist, and after the assessment of the disease, the oncologist actually requests for a service with the Stevenson Cancer Tumor Board. Then after the tumor board reviews the case, they send a detailed review back to the oncologist, who can then take care of the patient there in the same place. They don't have to come to the cancer center. And also, we found that the cancer center can actually benefit from an increase in clinical trial participation from these rural patients. And this has been shown. We studied like many benchmarks, including UC Davis and UNC, and we saw that through the use of these virtual tumor boards, they're resulting in 60% increase in clinical trial participation. And it's also benefit the patient, because through this, using this recommended treatment from the teletumor boards, there's an 88% reduction in treatment costs compared to standard therapy. And also it's been shown whenever the physicians use this recommended treatment from these teletumor boards, there's about double the amount of survival rate compared to standard therapy. And so to do this, the Stevenson Cancer Center need to do a proof of concept. And the cool thing about this requires like minimal to nothing, to no investment from the cancer center, except for the time that the physicians are going to use in discussing these cases. And from all these connections that we're going to make with the rural physicians, there's a potential for tertiary referrals that's going to increase the revenue for SCC. So to do this, we recommend that they start by using maybe one tumor board for the lung, for example, the lung cancer tumor board. And we know that the lung cancer tumor will meet every week, and they discuss about 20 cases per week. And out of those 20 cases, then just add 3 cases from the rural areas. So then they don't have to change things, they already have the infrastructure there. Then if they do that, within a year, we end up having 157 new cases that they discuss. And assuming that 60% of those end up enrolling in clinical trials, then we end up having 94 new patients, which is a huge chunk. I think right now, so far for the cancer center, they have about 240 patients in phase 1 clinical trials, and you can see having an additional 94 patients. That's a huge increase that can actually contribute to Stevenson mission. So all these solutions that we discussed so far, it's about bringing the patient to the cancer center or connecting to the patient virtually. So we wanted to find a way where we can actually bring Stevenson Cancer Center to the patient. So we looked at all different kinds of solutions, screening clinics, we looked at affiliates, we looked at infusion centers, and we narrowed down to infusion centers. So with infusion centers, the way it works, basically what it is it's a center where the patient goes to get their treatment. As you can see from the diagram, you have a patient, they go to the cancer center after the diagnosis and treatment, they go back to their community, and we have an infusion center there. So the patient, instead of going back to the cancer center, they stay in their community there. Then they get the infusion therapy, which includes chemotherapy, antibiotics, immunotherapy, anything that can be delivered to the patient via into their veins. So we use the Mercy Oncology and other benchmarks. We have done these infusion centers, and you can see they've shown that it's very successful to do it. And to do this, the Cancer Center needs to build a pilot program in the Tulsa region. So the reason why we chose this region in the Tulsa region, because most of the surrounding counties, they have high mortality rate and high incidence rates, and also the market share for SCC in this area is very low right now. So having this pilot infusion center can actually increase SCC market share in this area. And also this can actually serve as a litmus test for whether SCC if this is a good place to build a second comprehensive cancer care for the state cancer center. And so far we know that the cancer center only has 31 patients in this Tulsa region. So if they institute this infusion center there, we expect from all the calculations that we do based on the incidence rates, we project they're going to have an additional 350 new patients, which would be a huge difference in serving these people and a huge amount of revenue for the patients. And so far, all the solutions that this sounds all the solutions that we discussed about, and to tell you more about the 5-year plan, how the financial work is going to work in the next 5 years, I will turn it to Betsy.
So our calculations show that with these rural outreach strategies, Stevenson Cancer Center will generate $80 million of new revenue over the course of 5 years. So utilizing these 4 solutions, you can see the steady growth that Stevenson will see as a result. So assuming that 20% of these patients become full-time Stevenson patients, at $50,000 average per patient, that would equal the $80 million in revenue, which is a huge increase and would bring an excellent amount of patients to Stevenson and help them get better care they need. But there are steps that Stevenson can take today to go ahead and implement these, and to talk more about that, I'll hand this over to Ben.
Thank you, Betsy. What is exciting about the solutions we are preferring is that SCC can hit the ground running right now. So for the transportation issues for Angel Flight and ride sharing, they can actually begin piloting it tomorrow. And then for teletumor boards, the infrastructure is already there. What they need to do is to train new personnel to man it. And lastly, for the infusion centers, we have done market validation, but SCC would have to do a more comprehensive market validation before they launch in. And my team and I would soon present a specific implementation plan to SCC on how to implement these solutions that we are preferring. So we have shared with you what we have done this semester. We have done a lot of research, and we have talked to more than 50 patients and other experts in healthcare and business. And we have shared with you 4 innovative solutions that can improve cancer care access in rural Oklahoma, bringing in about more than 80 million in revenue for SCC for the next 5 years, and most importantly, improving the cancer care experience for more than 2,000 patients. Now, this semester, my team and I have experienced as firsthand the pains that patients go through in accessing cancer care. And we are happy that the work we have done would go a long way to improve the experience of these patients. Thank you so much for coming, and we'll at this point take questions.